So today I'm going to give an overview about nutrition in Duchenne. My background is actually as a dietitian, and then I've moved very much into research and understanding the role of nutrition in Duchenne. I thought I'd start today with a really simple overview of why nutrition is important in Duchenne. Nutrition affects so many parts of the body, and we really want to optimize nutrition so we can have the body functioning as best it can. Nutrition plays a key role in muscle health. It's key in immunity. As we've just heard, it's a really important factor in bowel health, bone health, and there's also relationships between nutritional status and respiratory health. One of the big things that we actually focus on in nutrition, especially in the early days, is around weight management and growth as well, because nutrition can really help in optimizing growth. So why do we need to think about weight management and growth in Duchenne? And it's interesting, what we see is boys with Duchenne can become very overweight or obese, so they can gain weight very quickly. And as this is some data from Australia, and each of the bars represents a different age group. So in our clinic, we're seeing actually about 1 in 2 boys who are obese, and that peaks around 11 or 11 years of age. But then we also see this flip kind of later on in adolescence and adulthood, where we see increasing prevalence of undernutrition. So in Duchenne, we are kind of faced sometimes with managing both over and undernutrition, and that can be a big change or a shift. So I wanted to touch on what appropriate growth looks like. You might have seen a growth chart like this somewhere in your clinic visits, and lots of different countries around the world have different forms of growth charts. What we use growth charts to really plot height and weight and track growth. The things that we're looking for, and this is really for children up to 18 and adolescents, is that height and weight are tracking. And when we say tracking, we mean essentially following their lines on the growth chart. The other thing that we look at is that height and weight are about on the same line. So in this example, the child is growing along the 25th centile for height and weight, and that's great. Children can grow along the 97th centile for height and weight, but if they're matching, that's the main thing that we're looking at. What we see in Duchenne is we see height actually start to plateau off, and that's a big part of steroids. But we also can see at the same time sometimes weight jumping up the curve. So we're seeing our lines not tracking. What we really want to be doing is trying to keep it tracking along the line as best we can. And that's really our goal when we're looking at growth. So why are we seeing both overnutrition and undernutrition in Duchenne? So obviously steroids play a big role in overnutrition. They increase appetite, and it's also very complex in terms of sometimes behavioural changes that happen in Duchenne and the interaction with food as well. There is underlying the overnutrition, some type of energy balance or calorie imbalance with diet versus activity. And that could be because of reduced activity. We're trying to understand whether boys and young men with Duchenne actually have different calorie requirements, because then that can help us prescribe calories more carefully for individuals with Duchenne. And calorie requirements could change because of reduced muscle mass, but there could also be some underlying mechanisms of impacting energy expenditure. In terms of undernutrition, there's a range of factors that contribute. It can be things like difficulties eating, getting food to the mouth and opening the mouth because of weakness around the jaw, chewing and swallowing, making mealtime really hard and causing fatigue and long meal times. There's a whole range of gastro problems that Professor Emmanuel just touched on, which really can contribute to not wanting to eat, and in the long term, that undernutrition. So does it matter? You know, are these just numbers? And my simple answer to you is yes, nutritional status does matter. We've been doing quite a lot of work actually looking at, you know, what does overnutrition and obesity mean especially in terms of clinical outcomes. So there's been some emerging data that shows that overnutrition does impact time function tests and 6-minute walk tests. In our research, we're seeing obesity contributes to sleep apnea and also using CPAP. Potentially there's an interaction with fracture risk as well, and also things like reduces energy levels and social implications as well. In terms of undernutrition, again, it's yes, we know if the body's not at its best state, it can find it harder to fight infection. It can, again, put extra stress on the lungs. The reduced energy level and fatigue also just contributes to almost a cyclic pattern, progressing the undernutrition. So what are some of the tips that I can help with today in terms of managing weight? I'll start with overweight and then I'll talk about underweight. So the first thing I would absolutely recommend is just to keep a track on weight. If you remember back to that graph, if we can pick up weight gain happening sooner, it actually means we can put in preventative strategies. And it's often much easier to put in strategies earlier before there's been a lot of weight gain. There'll be some key times when weight gain might come up, and that's when a boy is starting steroids or transitioning into a wheelchair, so energy requirements are changing. So, and also I think when we're thinking about weight management, our primary goal is always to stabilize weight. It's not about losing kilos of weight, and in fact, weight loss should be very carefully monitored on an individual basis. So, especially with children, what we want to do is keep weight stable. If there is some height potential, children then essentially grow into their weight. With Duchenne, if we can stabilize weight, we're avoiding that upward trajectory on the growth chart. So in terms of food tips, I've kept this quite broad because I know that I'm talking to people across many different countries, and we all eat very differently around the world. Some things I'd really encourage you to think about in terms of managing your weight. First and foremost is make changes that work for you as a family or a household. It's very hard to eat differently from everyone else in your house. So making changes together, we know from the evidence, is actually one of the best approaches to weight management in children. I really encourage you to think about your drinks that you're having. So some of the easiest things that we can start to change in diets are things like fizzy drinks, fruit juices and soft drinks. They contribute what we call as empty calories, so lots of energy with no nutrition. They're not great for our dental health either. So think about water and potentially some dairy drinks. Focus on the 5 food groups, whatever they look like for you. When we talk about the 5 food groups, it's really grains, fruit, vegetables, dairy, and then our meat or meat alternatives. If we shift our focus on to getting these foods in the day, then it's often kind of easier to get rid of some of the other foods. We also think about including proteins evenly across the day. So proteins come from our lean meats, our dairy, eggs, fish, and legumes as well. In Australia in particular, we eat all our protein mostly at our dinner meal. So what we encourage you to think about is how you can include protein at breakfast, lunch, dinner, and in your snacks. So distribute it evenly across the day, and that can really help with appetite. There's a range of what we call free foods that you can use to help manage hunger. So these are diet products, so perhaps diet soft drinks, or there's diet jellies, or differs in countries, but they can be really useful tools, I think, in terms of managing appetite. Berries of all forms, frozen, fresh, whatever's in season, are great snacks and are very low calorie. And then there's a whole range of non-starchy vegetables, so things like carrot sticks, celery sticks, cucumber sticks, capsicum sticks. Find a vegetable that your child likes, and these can be helpful in between meals. My son, I know he loves cucumber and carrot, so they're some of my go-tos. I know he'll eat them, and we use them kind of just in between meals. And finally, think about your mealtime environment. It's very easy, and we're guilty of this as a family sometimes, just to mindlessly eat our dinner, or if we've got screens on or other devices on, you're not kind of conscious of what's actually going in your mouth, or not responding as well to those cues saying you're full. So think about how you're eating. And most of the time, if you can sit and eat as a household or a family, that can be really positive. Also, to touch on fluid recommendations, I said about thinking about your drinks. Thinking about also getting enough fluid in is really key. So these are the recommendations from the Care Considerations in 2018. And really we'd like to see a lot of this being water, but there's also ways you can flavour up water to make it exciting if it's not great. So using fresh fruit in the water, for example, can help. So now I'm going to flip and talk a little bit about managing underweight. Again, having regular heights and weights where possible can be really key to actually picking up changes early. Some key times when we might actually start to see undernutrition is if there's been potentially a period of prolonged illness, if there's been increased respiratory requirements, so work of breathing can increase how many calories we need, say prior to starting something like NIV, or if there's major surgery, so for example, spinal surgery, these all could trigger periods of undernutrition. Again, our primary goal will be to stabilise weight, to stop further weight loss, and then, if necessary, regain that weight lost. There's a whole lot of different, I guess, levels of intervention when we're looking at undernutrition. So obviously, if we can, we do food. There's also a range of commercial supplements, as well as alternative feeding methods. And really, most often than not, it's a combination of all of these. So in terms of food tips for undernutrition, what we're trying to do is actually make every bite count. So we're looking at the quality of what's going in one mouthful, not increasing quantity, because we know that's really hard, just saying eat more. So we try and make what goes in count a lot more. Ways we do this is food fortification, and that's really adding fats to food. So things like oil, margarine, or butter, cream, cheese can really pack a punch in what goes in the mouthful. And again, proteins are really key. So we talk about high calorie, high protein diets to help with undernutrition. Milk drinks can be great. So they have, we can bump up the calories very easily by adding things like cream or even milk powder to milk to make it a really nourishing drink. Texture modification is also a really key strategy if malnutrition or undernutrition is related to dysphagia or difficulty swallowing. And this is where a speech and language pathologist is key. And they can advise on strategies to help make the most appropriate texture, and it can make it easier to eat. So it might be a mashed or a pureed diet for some foods. And speech pathologists and dietitians often work hand in hand because we'll help to make the recommendations together and make it work. As I said, there's a range of supplements that you can use, and some of the names that I think are quite used internationally are things like Resource, Ensure, and Sustagen. These contain a whole range of vitamins and minerals, as well as protein and calories. So some of them are actually complete sources of nutrition. Sometimes if the malnutrition progresses too much, or if there is quite significant dysphagia, a PEG may be required. So a PEG is a feeding device that goes straight into the stomach, so the food goes straight into the gut. There is evidence in Duchenne that shows that it does actually improve nutritional status and it's well tolerated. And up on the screen is the key considerations from the care guidelines. So we're seeing weight loss and dehydration, and again, that's unintentional weight loss or malnutrition, aspiration, so getting food into the lungs, with moderate or severe dysphagia. These are things that might trigger a discussion with your treating team about the use of a PEG. I guess, what I would say that it can actually be a very positive experience, because meal times can be incredibly stressful if you're trying to get food in and it's really hard. So PEG placements, if it's not because of dysphagia, people can continue our oral intake and it actually brings joy back to food. So these can be a very positive experience. So just Switching track a little bit, I'm going to talk now about nutrition for bones and nutrition for bowels, because there's some things that we can do in our diet to optimize your both bone and bowel health. We know in Duchenne that bone health is critical, and I know Jared's talked about it this week. The key nutrients we think about for bone health are calcium and vitamin D. So we can really try and optimize these as best we can. In terms of calcium, the main sources in our diet are dairy foods, so milk, yogurt, or cheese, but there's also a range of non-dairy sources. Hard tofu is a wonderful source of calcium. Things like fortified non-dairy milk, so for example, fortified soy milk, so it needs to have the calcium added in. There's other ranges, other sources such as broccoli and almonds, and these can contribute to calcium in the day, but they're actually very hard to meet your requirements through these foods. What we recommend is to eat enough calcium up to your national age recommendations, and if that's not possible, to replace calcium with a calcium supplement. In terms of vitamin D, we also know that boys have quite low vitamin Ds from a very young age. So this is primarily replaced through vitamin D supplementation. Though, again, different countries have different food supplies. In Australia, we have very little vitamin D in our food. So we really do rely on supplementation. But in other countries, you might have some other, key sources, especially through fish intake. Just to give you an example from Australia here, this is what we'd be aiming for in terms of dairy foods to get our calcium requirements. So somewhere between 2 or 3.5 serves. So, 2 cups of milk or 1 cup of milk and some cheese, for example. Next, I want to touch on nutrition for bowels, or nutrition for poo is probably the more appropriate thing to talk about. When we're thinking about what we're putting in, the key things when we're, and this is really probably mostly focused on constipation, is fibre and fluid, and they're key to having a healthy stool. There's 2 types of fibres that we want to encourage. There's 2 types of fibres, and they work a little bit differently. We have soluble fibre, which is mostly in fruits and oats. And the way I think about soluble fibre in my head is when water is added, it swells like a jam, and that makes it quite, a stool softener. We also have insoluble fibre, which is things from like whole grains, for example, or wholemeal rice, bread, and that adds bulk to stool. So that's almost your roughage in your diet. What we want to have is both types of fibres in our diet, because that actually contributes to a stool that has some bulk, but is also nice and soft. So looking at the types of fibres in our diet is really important. There's a range of fibre supplements that you can use, and actually they've progressed such a long way. They're now often tasteless, dissolve into a range of fluids. So they can be very helpful. Again, in Australia, in terms of what we're aiming for in fibre intake, is about 18 to 30 grams. And also, these are some of the strategies we can do from a dietary perspective, but as Professor Emmanuel talked about, there's also a range of medications that can help with constipation as well. I just wanted to give a plug for dietitians. I think sometimes we get a really bad rap as the food police, and we are not the food police. Most dietitians I know would enjoy a burger or a pizza. That is, if we're not these kind of anti-bad food people. Dietitians can just really help optimize or help families make better choices for some nutrition and fine-tune diets in terms of helping with weight management, bones, for example. We can also help with a whole range of other dietary requirements if there is allergies or intolerances, as well as managing things like supplements or alternative feeding strategies. Ideally, touching base with a dietitian, if they're in your clinic at least once a year. The recommendations say every clinic visit, and I know that's not possible for some clinics, but dietitians can really help. Finally, I thought I would just really touch on the world of supplements. There's a range of nutritional supplements that have been investigated in some form or discussed for Duchenne. The strongest evidence to date is really for creatine monohydrate, which has some Cochrane or high level evidence, scientific evidence to support its use. However, that has not been strong enough evidence to make one clear recommendation about supplement use. And the guidelines have not recommended supplements in either iterations. If you are thinking about supplement use, what I would recommend is actually to talk about it with your medical team, because there might be contradictions with medications, or make sure it's safe. I would also consider the expense and the quality of the supplements. So around the world, supplement industries are not as well regulated. There's different regulations in different countries. So you need to really make sure that you are getting what you pay for, because they can be quite expensive. And my key recommendation, if you are thinking about supplements and you talk to your medical team, is actually to think about how you can measure an objective outcome of if the supplement is working. So potentially touching base with your physio before starting and doing a functional assessment, and repeating that 3-6 months later to have something really kind of hard evidence to say, is this working? As Elizabeth said, we did some work in 2019 for World Duchenne Day, and we developed some great resources which still live on the website. So there's some fact sheets about nutrition, supplements, and a whole range of videos as well that may help. Thank you. That's my talk for today.